Welcome back, everyone. Today we will be dealing with the next topic in our syllabus, that is clinical teaching and bedside teaching. Okay, we will be learning about the methods of bedside teaching, importance of the bedside teaching, and also the key aspects in the bedside teaching. So, what is important? What is the importance of bedside teaching? You all know, we know that it is a cornerstone of the medical education. Without this bedside teaching, medical education is incomplete. And here is the situation where the learners or the students will learn or gain the practical experience, and also they'll know how to apply their theoretical knowledge which they have gained in the years of medical education, and how they will apply them in the practical setting, that's the real world settings in front of the patients. So here, in front of the patient, in the patient's bedside, the students will get an opportunity to do what? To observe, to interact, and practice their skills under a supervised clinician, okay, under the supervision of an experienced clinician. So that is a major importance of the bedside teaching or clinical teaching. Here the patients or the students will learn in the context of the actual real world setting of the doctor patient relations will be learned, the rapport creation will be learned, the clinical skills as in communication, the history taking, the physical examination, diagnostics, all these procedures will be learned. Okay, and the next important point in the clinical teaching method or the methods of clinical teaching is actually development or cultivation of the professionalism. Okay, professionalism is learned, and also empathy. Okay, how to empathize with the patient, how the clinicians, the supervisors, that is the experienced clinicians, how they interact with the patients. The student sees that and learns it and tries to apply that in their future practice. Okay, that is a major thing about clinical teaching. And now coming to the methods, we have something called as 1 minute preceptor. Okay, that is one kind of clinical teaching method. 1 minute preceptor is also called as OMP. Okay, that is actually we are testing or implying micro skills. Okay, basically five micro skills are there, they are applied, and that is how the teaching is done in case of OMP or 1 minute preceptor. Okay, that is one kind of method. There is a 5 steps teaching model. Okay, so what are these 5 steps? First one is get a commitment. Okay, get a commitment. Get a commitment is nothing but we will ask the students, that if we are the teacher, we'll ask the students or learners to commit to a diagnosis. Okay, they have to get to a diagnosis first. Okay, so we might ask, what do you think the patient is suffering from? What do you think the patient is complaining of? Okay, why is the patient is non-compliant or compliant with certain medication? Okay, so that is the first question the clinician or the supervisor asks to the student. Okay, so the student might be telling that it is an obvious case of appendicitis, or if it is an obvious case of pneumonia or diabetes mellitus. Okay, first the diagnosis is asked. Okay, that is the first one. Diagnosis, we'll just term it as diagnosis. Second important step or micro skill to be learned is probe for supporting evidence. Okay, probe for supporting evidence. Here the clinician will ask the learner or the student why they chose a specific diagnosis. Okay, why they chose the specific diagnosis, or else if the clinician is asking for certain test. Okay, if the student is asking for certain test, like we have to check for HbA1c, so the clinician will ask, why are you suggesting this test first? Okay, instead of doing a simple fasting blood sugar, why are you choosing this HbA1c test? Okay, those things. Or which medications are you suggesting, or which medications are available? Okay, available for this specific diagnosis. That is what the patient student will be answering. Okay, so that is about the probing for evidence or supporting evidence. Okay, this is actually, we have to remember, in this condition or this step, it is not a grilling. Okay, not a grilling process. The physician or the supervisor or the teacher should not grill the patient student. Okay, thereby if the patient is if the student is grilled, they'll develop a negative emotion, so that is not good for learning. So here we have to just properly ask, why do they think it is this specific diagnosis? Why do they think this is the test required? Why do they think this specific medicine is important for the condition? Okay, so we are asking why. First one is what. First point is what. Next we are asking why. The third point or third micro skill is teach. Okay, teach the general rules. Till now we were not teaching, we were just asking the student about their opinion or their things. Okay, so first 2 points we are just asking. The third point is the place where the physician teaches. Okay, so here we will just teach the general rules. Okay, so okay, we are teaching the student that okay, what your diagnosis is right and why it is right, and we will just briefly summarize. Okay, we'll briefly summarize a certain point in the diagnosis. Or for example, if the patient is having some case of headache, okay, if the patient is old, 70, 75 or 80-year-old patient with suffering with headache, and the student is diagnosing it as migraine, then we should give a little tip that in older patients with headache we have to consider other diagnoses also, like glaucoma, temporal arteritis, which is usually considered with the primary headaches. We should not directly jump to migraine. So those general rules regarding a specific diagnosis or a specific condition can be chosen, but we have to keep in mind we should not always teach. Okay, we should not always teach. We have to keep it brief. Okay, we also have to tell them what they did right. That is the fourth point. We have to tell them what they did was right. Okay, in this thing we are just we are praising the student. Okay, we are praising the student, telling that it's good that you did not directly jump into diagnosis of migraine. You considered the certain other differentials also. Okay, we have to, if it was in the case of diabetes mellitus, we have to tell the patient, tell the student that you did right by sending for HbA1c rather than FBS. Okay, certain things. So if the student is doing something right, we have to tell that you're right, that's a wise decision, or great job. This will be a rewarding method. Okay, this will boost the self-esteem of the student, and also helps the other learners who are there to acknowledge that. Okay, then fifth point, or the fifth or the last step in the ONP method or 1 minute preceptor, here it is the correction. Okay, correcting the mistakes, correct the mistakes. But remember, it is not a scolding session, so here we have to gently admonish. Okay, gently admonish or gently tell the learners to tell they have to be told that they did something wrong, and we have to consider that also. Okay, for example, if the patient is a smaller child and coming with a running nose, we have to know the student has to be told, if the student is telling the diagnosis to be upper respiratory tract infection and ruling out certain other conditions. Okay, so another condition without examining, so we have to tell the student that we cannot rule out certain other condition. For example, a child with upper respiratory tract infection can have otitis media also. So unless and until we haven't examined the ears, we cannot rule out otitis media entirely. Okay, so thereby we are correcting the mistake gently. You have to remember, gentle is the keyword here. We have to remember that. Fine. So this is about the micro skills in the OMP. Remember, get a commitment, supporting evidence has to be taken, teach a general rule, and tell what they did right and correct the mistakes. And the importance of this particular method of system is that it is it is not time consuming. The time constraint is not too much here. So within 10 minutes, okay, within 10 minutes or within a minute or so, it can be done. Okay, it can be completed. It is efficient in the clinical practice, and also we can move on to the next patient or next topic faster. Okay, easily we can get it within 10 minutes. Okay, 6 minutes can be taken for presentation, 3 minutes for asking, and 1 minute for discussion. Okay, this is the discussion level, and this one is for asking. Sorry, this one is for this asking, and also about the presentation, which takes part throughout. Okay, so that was about the 1 minute prescription as a perceptor. Next one is case-based learning. There is another method where case is presented in front of the students and they learn from that particular case. Direct observation feedback, that is we are going with the clinician. He is directly interacting with the patient. We are seeing it, and we will be observing, or the students will be observing the clinician and get knowledge from that. Okay, next, role modeling. Role modeling is like when the students are following a particular staff or a particular clinician. Okay, in bedside rounds. Okay, it is an indirect method of teaching. The teacher where the students are seeing the patient or teacher or the staff demonstrating professional behavior. We are seeing how they are interacting with the patient. Okay, their care or patient care is seen, and the learners observe. Okay, they observe it, and without any other formal instruction, they'll just observe. Okay, this is a major method for learning professionalism and even ethics. Okay, ethics and communication skills. That is how the students learn, by role modeling. Most of us will have our own role model when it comes to clinical practice, right? So that is the role modeling point. Then small group discussion. Similar way, a small group of clinics, okay, can be taken, and there in the discussion, same thing can be applied. Okay, that OMP method, right? Same thing can be done here. And one more thing in the clinics or bedside clinics is that the group is smaller, not as in a classroom. It is not a classroom setting, so the group is smaller, and the more effective method of teaching can be done. Next one is simulation based training. Simulation based training, again, it is like a simulation of a bedside clinics can be done. For example, if it's a group of students, one student can become a patient and the other can become the clinician, and thereby we are simulating a circumstance, simulating a real life situation, and thereby teaching the students how to behave or how to handle the case ethically. Okay, such things. Next, bedside rounds is the major or the traditional method of clinical teaching, where group of students will be led by a senior physician or senior clinician. They visit the patients at their bedside, discuss their cases, and there how integrating the patient care with the teaching. Okay, patient care and teaching are going together side by side. This will provide the students an opportunity to observe, okay, to observe the clinical reasoning in the physician's perspective. Okay, that is how it happens. And remember, it combines the patient care with the teaching, and provides the learners to present case and also receive feedback. Okay, bedside rounds is also that also, right? The physicians will give the students their own opportunity to present their cases, and also the physician will give feedback to them that will encourage active participation within the small group, and thereby increases the engagement. But one disadvantage of this particular method is the time. Okay, bedside rounds take a lot of time, so time constraints are the major problem, which can limit the depth of discussion. And also the patient, okay, the patient might feel uncomfortable, right? All the patients are not as good when it comes to bedside rounds. Some patients are not comfortable, okay, in discussing their problems in front of other students. Okay, so those are the major challenges in the bedside clinics or bedside teaching. The major challenges are, I'll just write it over here. Okay, major challenges are time. Okay, time constraint, it takes a lot of time, except for certain like 1 minute per septum, that doesn't require much time. But yeah, time constraint is one thing. Next, patient. Okay, patient's comfort is given high importance, right, in patient care. So patient, if they are not comfortable and patient is not consenting to have a bedside clinic, then that is a challenge, or that is an issue for the conducting of classes in the bedside. Next, variation. All the clinicians are not same in the way they teach. All the clinicians are not the same when they tend to the patient. Some might have another route. Okay, some might have a different route than the practical need, so that might be um, difficult to follow. Okay, so tailoring all the bedside teaching to meet the diverse needs of the students, and also along with that the patients, that is challenging in case of clinical teaching. Okay, so with that we finish this particular topic of clinical teaching and bedside teaching. We have learned the methods, the importance of it, and also the key aspects and the challenges are learned, and the major one here we have to learn about the micro skills. We have 5 micro skills. It's also called as OMP method, 1 minute per preceptor. Okay, first 2 sections we ask the student. If we are the staff or we are the physician or clinician, we'll ask the student about the get a commitment. We'll ask the student about the diagnosis. What do they think the problem is, or what do they think the appropriate medicine is? Okay, such things. And then we will ask for supporting evidence. Why do they think the patient is suffering from certain disease, or why do they think this medicine is better than the other one? Okay, that is the second point. Then we teach the general rules. Okay, we'll teach a little bit. We have to keep the discussion short. That is why majority or maximum 3 points can be taught in this section. Then we have to appreciate the student for what they did right. Okay, we have to appreciate the student for what they did right, but at the same time the fifth point comes here. We have to correct the mistakes also. Okay, but we have to do it gently. We have to gently tell the student that what they did was not right. Instead, if we can also think like this too. Okay, we are giving a suggestion. So yeah, that was about the major points regarding the bedside clinics and clinical methods. So thank you for listening. Make sure to subscribe. We have created a playlist regarding the NTET classes. So under that playlist, everything will be available for you, all the classes. So thank you for listening. We'll be back with another video another day. Okay. Thank you.